I'm joined in studio by Slindela Masekane. Good morning to you, Slee. You've got all the numbers. You're tracking what's happening globally, the spike in Italy, and what's happening on our continent. Tell us what you have.
Certainly, Sally. So as things stand, the global number of reported cases of the COVID-19 has surpassed the 100,000 mark. Now, COVID-19 is affecting countries and territories around the world, as well as the Diamond Princess cruise ship harbored in Yokohama. Now, the cruise ship has 696 confirmed cases aboard with 7 deaths. Now, when you look at the global picture, Sally, we are looking at around 109 countries now who are confirming cases of the virus. We're looking at over 110,000 cases, as well as 3,830 deaths. Now, taking a look at the epicenter of where it all started, we're also, Sally, recording from the World Health Organization, I must add, that 8 new countries overnight, Bulgaria, Costa Rica, the Faroe Islands, French Guinea, the Maldives, Malta, Martinique, as well as the Republic of Moldova, have reported the cases of COVID-19. That's in the past 24 hours. And so now, as we take a look at the epicenter of where it all began, that's in China. They're now sitting with over 80,000 confirmed cases, and they have recorded over 3,000 deaths. That's where the bulk of the global deaths are sitting. And if we look at the top 5 countries, in fact, that are recording a high number of recorded cases, South Korea tops the list with over 7,000 confirmed cases, as well as 53 deaths. We are also looking at Italy, that's had a spike actually overnight. They're sitting with now 7,000 cases, as well as 366 deaths. In fact, in Italy, 16 million people in Lombardy, as well as other parts of the north of Italy, are now subject to quarantine, and the country is recording 133 deaths just overnight. Now, we're also looking at Iran with over 6,000 cases, 194 deaths. France coming in 4th place with over 1,200 deaths, as well as Germany not recording any deaths thus far. Now, coming closer to home, when we look at our continent here in Africa, we are seeing that 9 countries, in fact, are affected, several in West Africa. Starting with the highest number of confirmed cases, we are looking at Egypt, that is now sitting with 55 confirmed cases and recording the first death on the continent. A German tourist, we understand, died on Sunday in a Sinai resort of eastern Egypt, making it the first death on the continent. We're also looking at Algeria coming in with 20 cases, Senegal with 4, South Africa now sitting with 3, Morocco 2, Cameroon 2, Tunisia also sitting on 2, Togo and Nigeria still sitting on 1. Now, when we look at our situation here, actually closer to home here in South Africa, following that confirmation of the 3rd confirmed case in the country, I understand, of course, that the 3rd confirmed case is now, of course, the KZN woman who's the wife of patient 0. Now, also, we understand that we are expecting the results of the 6 other group members who formed part of that group of 10 South Africans that made their way to Italy for a skiing trip. We expect that their results will be in the next 48 hours. Now, we are, of course, urging people to take, safety measures as the corona cases are coming in. And, of course, you can stay up to date with the latest information on the COVID-19 outbreak, which is available on the World Health Organization website, as well as through your national and local public health authorities. So please do take care of your health and protect others by doing the following. Just wash your hands frequently, maintain a safe social distance. So if we're looking at around 3 feet or 1 meter distance between yourself and anyone who's coughing or sneezing. Also, please do avoid touching your eyes, your nose, as well as your mouth. Practice respiratory hygiene. This means covering your mouth or your nose with a bent elbow as you're sneezing or coughing. And then please do dispose of a used tissue immediately. And if you are feeling a bit feverish or feeling like you have a slight cough or difficulty breathing, just seek medical care immediately or a as soon as possible. There's also a helpline number, Sally, for anyone looking for more information. That number is 0800 029 999. That number again, 0800 029 999, Sally.
Thank you very much, Slee.